Baltimore, we have a lot of hospitals, y'all. It's crazy how many we have just in Baltimore City, and when we think about the Baltimore County area and how they connect. But we still have maternity care deserts, even with all of these hospitals that are available, even with all of the clinics, even with all the doulas that have emerged over the last 10 years.
If you could have one superpower to improve maternal health, what would it be? Do you think that doula work really has to do with advocacy? And that's very different from what happens in the medical field, which I do believe they have our best interests at heart most times. But you guys are really there to support the person, the family, and you guys are the mouthpiece a lot of times for these individuals. And with that, you guys are having to do a lot of work outside of just a typical 9 to 5.
Today at our session called Birthing in Baltimore, we discussed some of the commonalities, some of the issues that we're seeing here in Baltimore City, but we also discussed a lot of the resources and the things that we have in place that can help support moms have better and healthier birth outcomes. And we talked about, as different community organizations and doulas and community members, how we can collaborate to improve maternal child health here in Baltimore City. One part of the session that I really enjoyed is when we had kind of a brainstorming session where we got to think about what would Baltimore look like to you? What's your ideal Baltimore area for the birthing mom? And a lot of people talked about making sure that everyone had access to all the resources they needed, that they knew about the resources and had access to it, that they had all the supplies that they needed, and that all of our community organizations just came together to sort of create a village around all the birthing women here in Baltimore to ensure that not just so they have a healthy birth, but for years afterwards, in the postpartum period, even the healthy start of the lifestyle for the child as well.
Work that you're doing here in maternal child health is beyond measure, honestly. We all know that in this moment in time, this is probably one of the most pressing issues for our communities. So to see the many folks who are activated to do this work is just really heartwarming, and it gives me hope for a future where our babies will be born healthier